Question 1. What is the primary characteristic of sinus rhythm? A. P wave is absent. B. The PR interval is greater than 0.20 seconds. C. The P wave is regular and precedes each QRS complex. D. The QRS complex is greater than 0.12 seconds. Answer. C. The P wave is regular and precedes each QRS complex. Rationale. In sinus rhythm, the P wave is regular, and it precedes every QRS complex. Option A is incorrect because the P wave is present. Option B refers to first-degree heart block, and option D refers to a bundle branch block. Question 2. Which of the following is characteristic of atrial fibrillation? A. Regularly irregular rhythm. B. Absence of P waves. C. Narrow QRS complexes. D. The PR interval is greater than 0.20 seconds. Answer. B. Absence of P waves. Rationale. In atrial fibrillation, there is no distinct P wave due to chaotic atrial activity. Option A is incorrect because the rhythm is irregularly irregular. Option C is typical but not specific to atrial fibrillation. Option D describes first-degree AV block. Question 3. What does a prolonged QRS interval typically indicate? A. Atrial flutter. B. Ventricular tachycardia. C. Conduction delay or bundle branch block. D. Sinus arrhythmia. Answer. C. Conduction delay or bundle branch block. Rationale. A prolonged QRS interval suggests a delay in ventricular conduction, such as a bundle branch block. Option A and B involve abnormal rhythms, but do not necessarily cause a prolonged QRS interval. Option D is a normal variant. Question 4. What is the normal range for a PR interval? A. 0.12 to 0.20 seconds. B. 0.08 to 0.12 seconds. C. 0.20 to 0.30 seconds. D. 0.30 to 0.40 seconds. Answer. A. 0.12 to 0.20 seconds. Rationale. The normal PR interval is between 0.12 and 0.20 seconds. Option B is too short. Option C and D are too long and indicate abnormal conduction times. Question 5. What does a peak T wave typically indicate? A. Hypokalemia. B. Hyperkalemia. C. Myocardial infarction. D. Ischemia. Answer. B. Hyperkalemia. Rationale. Peak T waves are most commonly associated with hyperkalemia. Option A is associated with flattened T waves. Option C and D may cause abnormal T wave morphology, but they are not as specific as hyperkalemia. Question 6. Which of the following is a key characteristic of ventricular tachycardia, VT? A. Regular rhythm with a rapid heart rate. B. P waves are visible before each QRS complex. C. QRS complexes are narrow and regular. D. The PR interval is measurable. Answer. A. Regular rhythm with a rapid heart rate. Rationale. VT typically presents with a regular, fast rhythm and wide QRS complexes. Option B is incorrect because P waves are not usually visible in VT. Option C and D are characteristic of other arrhythmias. Question 7. What is indicated by an ST segment elevation on an ECG? A. Atrial fibrillation. B. Myocardial ischemia or infarction. C. Hypokalemia. D. Bundle branch block. Answer. B. Myocardial ischemia or infarction. Rationale. ST elevation is a hallmark of myocardial injury, particularly in the case of a STEMI. Option A and D do not cause ST elevation, and Option C is related to electrolyte imbalances that can affect other parts of the ECG. Question 8. What is the characteristic finding of second-degree heart block, type 2 Mobitz 2? A. Regularly dropped beats without a preceding PR interval prolongation. B. Progressive PR interval lengthening before a drop beat. C. A normal QRS complex followed by a drop beat. D. A consistently long PR interval greater than 0.20 seconds. Answer. A. Regularly dropped beats without a preceding PR interval prolongation. Rationale. In type 2 heart block, there is no gradual PR interval lengthening before the drop. Instead, beats are dropped at regular intervals. Option B describes type 1 Wenckebach. Option C is not specific. And option D is incorrect because PR intervals may be normal or prolonged. Question 9. What is the clinical significance of a wide QRS complex? A. It suggests normal conduction through the ventricles. B. It indicates a delay in ventricular conduction. C. It is a sign of atrial fibrillation. D. It suggests a rapid ventricular rate. Answer. B. It indicates a delay in ventricular conduction. Rationale. A wide QRS complex usually indicates delayed conduction in the ventricles, such as in bundle branch block or ventricular rhythms. Option A is incorrect because a wide QRS indicates abnormal conduction. Option C and D are unrelated to the cause of a wide QRS. Question 10. In which condition would you expect to see a sawtooth pattern on an ECG? A. Atrial flutter. B. Sinus tachycardia. C. Ventricular fibrillation. D. Atrial fibrillation. Answer. A. Atrial flutter. Rationale. A sawtooth pattern is characteristic of atrial flutter, where rapid atrial depolarization creates this distinct pattern. Option B and D are irregular rhythms without the sawtooth appearance, and option C shows chaotic, unorganized electrical activity. Question 11. Which ECG finding is characteristic of a myocardial infarction? A. T-wave inversion. B. ST segment depression. C. ST segment elevation. D. Wide QRS complex. Answer. C. ST segment elevation. Rationale. ST elevation is a hallmark of myocardial injury and infarction. Option A is associated with ischemia. Option B indicates subendocardial ischemia. And option D is a sign of conduction delay. Question 12. What is the normal heart rate range for an adult at rest? A. 40 to 60 BPM. B. 60 to 100 BPM. C. 100 to 120 BPM. D. 120 to 160 BPM. Answer. B. 60 to 100 BPM. Rationale. The normal resting heart rate for adults ranges from 60 to 100 BPM. Option A is too slow. Option C and D are too fast for a resting heart rate. Question 13. What does a QRS complex duration greater than 0.12 seconds suggest? A. Sinus rhythm. B. Atrial fibrillation. C. Bundle branch block. D. Ventricular fibrillation. Answer. C. Bundle branch block. Rationale. A QRS duration greater than 0.12 seconds is often seen in bundle branch block due to delayed conduction. Options A, B, and D do not typically present with prolonged QRS duration. Question 14. Which arrhythmia is commonly associated with a sawtooth P-wave pattern? A. Atrial fibrillation. B. Atrial flutter. C. Ventricular tachycardia. D. Sinus arrhythmia. Answer. B. Atrial flutter. Rationale. The sawtooth pattern of P waves is characteristic of atrial flutter. Atrial fibrillation, option A, has irregularly irregular rhythms without distinct P waves, and ventricular tachycardia, option C, involves wide QRS complexes. Question 15. What is the primary concern with a heart rate of 180 BPM in an adult? A. Sinus tachycardia. B. Atrial fibrillation. C. Ventricular tachycardia. D. Normal response to exercise. Answer. C. Ventricular tachycardia. Rationale. A heart rate of 180 bpm with wide QRS complexes suggests ventricular tachycardia, a life-threatening arrhythmia. Sinus tachycardia, option A, typically has a normal QRS duration. Question 16. What does an absent P wave on the ECG indicate? A. Sinus tachycardia. B. Atrial fibrillation. C. Atrial flutter. D. Second-degree AV block. Answer: B. Atrial fibrillation. Rationale: an absent P wave with an irregular rhythm is characteristic of atrial fibrillation. Options A and C have visible, though often irregular, P waves, and option D typically presents with drop beats and visible P waves. Question 17. What is the first treatment step for a patient with sustained ventricular tachycardia? A. Administer atropine. B. Perform synchronized cardioversion. C. Administer oxygen. D. Start CPR immediately. Answer: B. Perform synchronized cardioversion. Rationale: for sustained ventricular tachycardia with a pulse, synchronized cardioversion is the first treatment step. Atropine, option A, is used for bradycardia, and CPR, option D, is for pulseless patients. Question 18. What does a long QT interval indicate? A. Increased risk for ventricular arrhythmias. B. Heart failure. C. Sinus bradycardia. D. Myocardial infarction. Answer: A. Increased risk for ventricular arrhythmias. Rationale: a prolonged QT interval increases the risk of dangerous arrhythmias like torsades de pointes. Options B, C, and D may involve changes in the ECG, but they are not as directly associated with a prolonged QT interval. Question 19. Which finding is typical of first-degree AV block? A. PR interval greater than 0.20 seconds with a regular rhythm. B. Dropped QRS complexes. C. P waves that are not followed by QRS complexes. D. Wide, irregular QRS complexes. Answer: A. PR interval greater than 0.20 seconds with a regular rhythm. Rationale: first-degree AV block is characterized by a prolonged PR interval greater than 0.20 seconds with a regular rhythm. Option B and C describe more advanced blocks, and option D describes a bundle branch block or ventricular arrhythmia. Question 20. What is the characteristic feature of a sinus arrhythmia? A. Regularly irregular rhythm. B. A consistently long PR interval. C. Variation in the PP interval with respiration. D. P waves that are absent. Answer: C. Variation in the PP interval with respiration. Rationale: sinus arrhythmia is a normal variation in heart rate due to respiration, causing the PP interval to vary. Option A is characteristic of atrial fibrillation. Option B refers to first-degree AV block, and option D describes atrial fibrillation. Question 21. What is the primary characteristic of ventricular fibrillation? A. Chaotic, unorganized electrical activity. B. Regularly spaced QRS complexes. C. A slow heart rate with regular P waves. D. Broad, regular QRS complexes. Answer: A. Chaotic, unorganized electrical activity. Rationale: ventricular fibrillation presents as chaotic electrical activity with no identifiable waves or rhythms. Options B, C, and D describe normal or abnormal rhythms with organized electrical activity. Question 22. What is a U wave on the ECG most commonly associated with? A. Hyperkalemia. B. Hypokalemia. C. Myocardial ischemia. D. Bundle branch block. Answer: B. Hypokalemia. Rationale: the U wave, a small wave after the T wave, is often seen in patients with hypokalemia. Option A is more associated with peak T waves, option C with ST segment changes, and option D with wide QRS complexes. Question 23. What is the typical ECG finding in atrial tachycardia? A. Regular P waves with a rapid rate. B. No P waves and irregularly irregular rhythm. C. P waves are present but hidden in the preceding T wave. D. A prolonged PR interval with a normal QRS complex. Answer: C. P waves are present but hidden in the preceding T wave. Rationale: atrial tachycardia is characterized by P waves that are often hidden in the preceding T wave due to the rapid atrial rate. Options A and D describe other rhythms, and option B is more characteristic of atrial fibrillation. Question 24. What is the primary concern with a QRS duration of 0.16 seconds? A. Sinus tachycardia. B. First-degree AV block. C. Bundle branch block. D. Atrial fibrillation. Answer: C. Bundle branch block. Rationale: a QRS duration of 0.16 seconds suggests a bundle branch block, as the ventricular conduction is delayed. Options A, B, and D do not typically result in prolonged QRS duration. Question 25. What is the characteristic rhythm of second-degree AV block, type 1 Wenckebach? A. Progressive PR interval prolongation followed by a drop beat. B. Regular PR interval with drop beats. C. No PR interval and no drop beats. D. Long PR interval with a prolonged QRS complex. Answer: A. Progressive PR interval prolongation followed by a drop beat. Rationale: in Wenckebach, the PR interval progressively lengthens until a QRS complex is dropped. Option B describes type 2, option C describes atrial fibrillation, and option D is indicative of bundle branch block. Question 26. What is the main risk associated with left ventricular hypertrophy, LVH, on the ECG? A. Elevated ST segment. B. Increased risk of arrhythmias. C. Prolonged QT interval. D. Narrow QRS complexes. Answer: B. Increased risk of arrhythmias. Rationale: LVH increases the risk of arrhythmias, particularly ventricular arrhythmias. Elevated ST segments can be seen with ischemia, and prolonged QT and narrow QRS are not typically associated with LVH. Question 27. Which of the following is true regarding the T wave on the ECG? A. It represents ventricular depolarization. B. It follows the QRS complex and represents ventricular repolarization. C. It is always upright in all leads. D. It should not exceed 0.10 seconds in duration. Answer: B. It follows the QRS complex and represents ventricular repolarization. Rationale: the T wave represents the repolarization of the ventricles. It can be either upright or inverted in different leads depending on the clinical context. Options A and D are incorrect, and option C is not always true. Question 28. What is the significance of a prolonged QT interval? A. Risk for torsades de pointes. B. Decreased myocardial oxygen demand. C. Increased risk for atrial fibrillation. D. Impaired heart rate recovery after exercise. Answer: A. Risk for torsades de pointes. Rationale: a prolonged QT interval can lead to torsades de pointes, a type of life-threatening arrhythmia. The other options do not directly relate to the risks of prolonged QT. Question 29. Which of the following arrhythmias can lead to an increased risk of stroke? A. Atrial fibrillation. B. Sinus arrhythmia. C. Ventricular fibrillation. D. Sinus tachycardia. Answer: A. Atrial fibrillation. Rationale: atrial fibrillation increases the risk of thrombus formation in the atria, which can lead to stroke. Sinus arrhythmia, ventricular fibrillation, and sinus tachycardia do not pose a similar risk. Question 30. What is the primary feature of a normal sinus rhythm? A. P waves are absent. B. PR interval is irregular. C. Heart rate is 60 to 100 BPM with a regular rhythm. D. The QRS complex is wide and irregular. Answer: C. Heart rate is 60 to 100 BPM with a regular rhythm. Rationale: normal sinus rhythm has a heart rate between 60 and 100 BPM and a regular rhythm. Options A, B, and D describe abnormal rhythms. Question 31. What does a J-point depression typically indicate on an ECG? A. Myocardial ischemia. B. Hyperkalemia. C. Left bundle branch block. D. Hypercalcemia. Answer: A. Myocardial ischemia. Rationale: a J-point depression is often seen in the early stages of myocardial ischemia, indicating possible injury to the heart muscle. Options B, C, and D are unrelated to J-point depression. Question 32. What ECG finding is characteristic of a patient with hyperkalemia? A. Peak T waves. B. Prolonged QT interval. C. Shortened PR interval. D. Wide QRS complexes. Answer: A. Peak T waves. Rationale: hyperkalemia is commonly associated with peak T waves, which can eventually progress to more severe arrhythmias. Prolonged QT, shortened PR, and wide QRS complexes are seen in different conditions. Question 33. What is a common ECG finding in patients with chronic obstructive pulmonary disease, COPD? A. Sinus tachycardia. B. Right axis deviation. C. Left ventricular hypertrophy. D. Atrial flutter. Answer: B. Right axis deviation. Rationale: COPD can cause right ventricular strain, leading to right axis deviation on the ECG. Sinus tachycardia, option A, may occur with respiratory distress, but it is not specific to COPD. Question 34. What does the presence of Q waves on the ECG suggest? A. A previous myocardial infarction. B. Acute ischemia. C. Atrial fibrillation. D. Hypokalemia. Answer: A. A previous myocardial infarction. Rationale: Q waves are indicative of a previous myocardial infarction, reflecting necrotic tissue. Acute ischemia typically causes ST elevation or T-wave inversion, not Q waves. Question 35. What is the effect of digitalis digoxin on the ECG? A. Prolonged PR interval. B. Shortened QT interval. C. T-wave inversion. D. Increased heart rate. Answer: A. Prolonged PR interval. Rationale: digitalis can cause a prolonged PR interval due to its effect on AV node conduction. It does not shorten the QT interval, cause T-wave inversion, or increase the heart rate directly. Question 36. What ECG finding is characteristic of second-degree AV block type 2, Mobitz 2? A. Progressive PR interval lengthening with dropped beats. B. Regular rhythm with occasional dropped beats. C. Dropped QRS complexes with no PR interval prolongation. D. P waves that are not followed by QRS complexes. Answer: B. Regular rhythm with occasional dropped beats. Rationale: in Mobitz 2, the PR interval remains constant, and there is regular dropping of QRS complexes. Option A describes Mobitz I. Option C refers to other types of blocks, and Option D describes atrial fibrillation. Question 37. What does a prolonged PR interval suggest? A. Sinus arrhythmia. B. First-degree AV block. C. Ventricular tachycardia. D. Atrial fibrillation. Answer: B. First-degree AV block. Rationale: a prolonged PR interval greater than 0.20 seconds is characteristic of first-degree AV block. Option A refers to a normal variant. Option C involves wide QRS complexes. And Option D involves an irregular rhythm. Question 38. Which of the following ECG findings is most likely associated with a high risk of sudden cardiac death? A. Sinus tachycardia. B. Ventricular fibrillation. C. Atrial flutter. D. Sinus arrhythmia. Answer: B. Ventricular fibrillation. Rationale: ventricular fibrillation is a life-threatening arrhythmia that can lead to sudden cardiac death. Sinus tachycardia, option A, and atrial flutter, option C, are less immediately dangerous, and sinus arrhythmia, option D, is typically benign. Question 39. What does the QT interval represent on the ECG? A. Ventricular depolarization. B. Atrial depolarization. C. Ventricular repolarization. D. Atrial repolarization. Answer: C. Ventricular repolarization. Rationale: the QT interval represents the time for ventricular depolarization and repolarization. Options A, B, and D refer to other parts of the cardiac cycle. Question 40. In which situation would you expect to see a heart block on the ECG? A. Myocardial infarction. B. Increased sympathetic tone. C. Right ventricular hypertrophy. D. Impaired conduction through the AV node. Answer: D. Impaired conduction through the AV node. Rationale: heart block occurs due to impaired conduction through the AV node, resulting in delays or failure to transmit impulses. Myocardial infarction can cause heart block, but not always. Increased sympathetic tone and right ventricular hypertrophy do not typically cause heart block. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.